Good evening, friends. I'm Dr. Aajay Shah, and I'm bringing this another Facebook Live tonight. Tonight's topic is diabetes segment 5 and 6. As many of you have seen, our diabetes talk last Saturday, which was in 13 segments. Now I'm doing this talk in 2 segments at a time. I already have recorded segment 1 and 2, and then segment 3 and 4. And tonight we're going to cover segment 5 and 6. Segment 1 and 2 already are on YouTube. I hope you have seen it already. Segment 3 and 4 are also already on YouTube. So if you have not watched segment 1, 2, 3, and 4, please watch those segments when you have time. Tonight we are going to cover segment 5 and 6. But before we start, let me repeat some other things we are doing. Number one, we are offering a health coaching now. So if you are interested, I'll give you phone number and information. So reach out to us. Again, we are offering health coaching now, which is very cost effective. Best way to get healthy, best way to get off many medications. If you're diabetes, you can definitely reverse the type 2 diabetes. We are also offering some Zoom calls, group Zoom calls. I realized that talking to all of you through Facebook is good, but talking to you on a one-on-one and answering your questions is actually more productive and definitely more useful to you. So I'm also scheduling some Zoom calls. If you are interested, I'll show you how you can reach out to us. So let's start with our segment 5 and 6 today. So again, this is segment 5 on diabetes. We have covered until now the prevalence of diabetes, why diabetes happens. We have talked about obesity. Starting now, we're going to talk about diabetes diagnosis. So how we diagnose diabetes. So let's talk about some normal numbers. Normal fasting sugar is below 100. Again, this is normal defined by American Diabetic Association. So again, normal is below 100. As you have heard from my lecture before, that any sugar above 84 is actually abnormal. But let's see for now, any sugar above 100 is abnormal. A1C, which is the 90-day average of sugar, anything below 5.7 is normal. But like I've explained you before, any A1C above 4.9 is abnormal. And then 2-hour glucose tolerance test after taking 75 grams of carbohydrate below 140 is normal. If you look at the pre-diabetes, when the sugar is between 100 and 125, that's pre-diabetes. This is again a fasting sugar. And when A1C, which is the, again, 90-day average of sugar between 5.7 and 6.4 is pre-diabetes. And when 2-hour glucose tolerance test is between 140 and 199, that's pre-diabetes. In terms of diagnosis, diabetes, any fasting blood sugar above 126 is diabetes. Any A1C above 6.5 is diabetes. And when you do 2-hour glucose tolerance test, is any sugar above 200 is diabetes. So what are the symptoms of diabetes? Typically, these symptoms happens more so with type 2 diabetes, where a person would always feel tired. Many times they will feel thirsty. Many times they will have a frequent urination. They will always feel hungry. They may have sudden weight loss. They may have a blurred vision. They may have many different infections. They may have numbness and tingling on their feet, and they may have a difficulty in healing their wounds. So again, there are many symptoms. These are some of the common symptoms which happens because of high sugar and insulin resistance. So let's talk about diabetes management. Until now, we have covered why diabetes happens. If you have not watched those videos, please watch those videos. It's very important you watch those videos, because the management of diabetes is going to depend upon how much you understood why type 2 diabetes happens, why insulin resistance happens. So definitely watch segment 1, 2, 3, and 4. I've also covered a lot of slides on obesity, because obesity is a major reason for type 2 diabetes. So make sure you watch segment 1, 2, 3, and 4. They all are on YouTube. So let's talk about diabetes management. Most doctors and patients think that lowering sugar and A1C is the main goal. Again, listen to this. Most doctors and patients think that lowering the blood sugar and A1C is the main goal. Actually, that goal is a secondary goal. that goal is a secondary goal. It's very important you lower sugar and A1C, but that's not the primary goal. The primary goal is to reverse the insulin resistance and abolish the insulin resistance. So again, primary goal is to reverse the insulin resistance. Again, let me give you an analogy. When a person develops a food infection and person has fever, giving Tylenol for the fever will take care of the fever, but will not take care of the infection. And for the infection, you need to give an antibiotic. Same way, when the sugar is high, taking care of the sugar is like taking care of the fever with Tylenol, but not going to the root cause in diabetes, which is the insulin resistance. So again, remember, all of you, primary goal is to reverse the insulin resistance. Primary goal is to reverse the insulin resistance. Secondary goal is to lower the sugar and lower the A1C. Very, very important thing to remember. Primary goal is to reverse the insulin resistance. Precautions, again, when you start following this plan, your sugar may start coming down very rapidly. Matter of fact, it will. If you follow what I'm going to teach you, your sugar is going to start coming down. Your blood pressure may come down also because you will start losing weight on a regular basis. You may not eat salt, and your blood pressure will also come down. If that's the case, you may need less medications. So if you start following my plan, please stay in touch with your doctors so your doctor can lower the need of your medication. So again, this is a precaution for all of you. So what doctors and patients think? Most doctors and patients think that type 2 diabetes is a chronic progressive disease, but that's a big lie from a medical community. Type 2 diabetes can be prevented and can be reversed in very short time. Again, type 2 diabetes can be prevented and reversed in very short time. Most doctors, again, believe, including possibly your doctors, that diabetes can never be reversed. But let me tell you, it is 100% reversible if you follow my plan. Many doctors feel like diabetic complications are bound to happen. But let me tell you, you can prevent all the diabetic complications, which we will cover as we go. Again, most doctors are wrong. We can reverse the type 2 diabetes, and we can prevent many type 2 diabetic complications. Again, type 2 diabetes does not have to be progressive, and it can be reversed in most cases. Again, primary goal, to keep repeating myself, primary goal in type 2 diabetes is reverse the insulin resistance. And keep repeating myself, reverse the insulin resistance. Secondary goal is to control the blood sugar and lower the A1C. And the tertiary goal is also to prevent the complications and maintain the lifespan. Because I explained you that average lifespan for diabetic is 10 years less than non-diabetic. So again, diabetic person lives 10 years less than a non-diabetic patient. So our goal is to prevent the complications and maintain the lifespan as if you don't have diabetes. So again, how I want you to think when you have type 2 diabetes. First, I want you to think that I have high insulin resistance, that you have high insulin resistance, and then you think you have a high sugar. So think that you have insulin resistance before even you think that you have high sugar. Always think that I have high insulin resistance and I have to reverse the insulin resistance. And then you think of a sugar. So what are the goals in diabetes management? Number one, A1C goal, or how your sugars are running, blood pressure and cholesterol goals. And then I will talk about which blood test needs to be done. We will extensively cover diet, what you should be eating, what you should be drinking. And then we will cover medications to lower A1C. We will also cover what other medications, if you're diabetes, you should be on, what labs, what blood work needs to be done, how to prevent complications. We will go over through every complication in detail so you know what complications to prevent. And then I will also cover in detail how to reverse type 2 diabetes and insulin resistance. So what is the A1C target? Again, A1C is the 90-day average of blood sugar. And normal A1C is below 5.7. Any A1C above 6.5 is type 2 diabetes. Once you're diabetes, American Diabetic Association have set the guideline of A1C of below 7. If you are at a low risk of hyperglycemia, that means if your blood sugar dangerously did not drop any time, then you can set your A1C goal below 7. And I will tell you that below 7 is a kind of a cop out, is a kind of a mediocre goal, and I'll explain you why. American Diabetic Association sets a A1C goal of 7.5 if you are at risk of hypoglycemia or low blood sugar levels. And I'll explain you also why. In my opinion, if you are off diabetic medications and if you are reversing your diabetes with lifestyle, with healthy eating, with exercise, then your goal should be below 5.7. And that, in my opinion, is the optimal goal. But again, we have settled for 7 because to prevent the hypoglycemia or to prevent the low blood sugar readings, because hypoglycemia or low blood sugar reading is much more dangerous than slightly high sugar. So again, goal is 7 to prevent the hypoglycemia. This is a very busy slide, but let me explain you. Here it says that if you have a low risk of hyperglycemia, then set your goal 7 or below 7. If your diabetes is newly diagnosed and if you're a young person, again, set the goal below 7. If your diabetes is long-standing, then set the goal 7.5 or higher. If your life expectancy is long, if you are a young person, set a goal below 7 or 7. If you are older, particularly above 85, maybe setting a goal of 7.5 is a reasonable thing. If you have a lot of comorbidities, that means a lot of heart disease, history of a stroke, or many other kidney complications, then set the goal at 7.5 or 8. If you don't have any of those comorbidities, then set the goal below 7. If you already have vascular complications like heart blockage, strokes, then again set a goal at a 7.5. If you don't have those complications, then set a goal below 7. If a patient is very compliant, patient is very motivated, if patient is able to afford the medications, then set the goal below 7. And again, depending upon all the resources you have, you can set the goal below 7. But let me give you my advice, my opinion. You all should be going off insulin, gradually going off all type 2 diabetic medications if you have type 2 diabetes, and eventually reversing diabetes. And if that's the case, set the goal of A1C below 5.7, below 5.7. But again, I explained you in earlier segments that actually A1C above 4.9 is abnormal. So try to lower your A1C as low as possible. To give you an example, my A1C was 5.9 4 years ago. Now I have lowered my A1C to 5.2. Goal obviously is 4.9, but for my age, I'm 57 years old, 5.2 A1C is a very, very good A1C, an excellent A1C. So make sure you know your A1C if you have diabetes, reverse the diabetes, get off insulin, get off the medications if you can. Obviously, work with your doctor and lower your A1C as low as you can. What are the blood pressure and cholesterol goals? If you have type 2 diabetes or if you have diabetes, blood pressure should be below 120. There are certain type of medications we use to treat the blood pressure in diabetes, particularly medicine called ACE inhibitor or angiotensin receptor blocker, we call ARB. Those are common medications because they also protect the kidney. So talk to your doctor what kind of medication you should be on. Many diabetics require 2 or 3 blood pressure medications. So make sure you talk to your doctor to get your blood pressure below 120 over 80. Some diabetic patients drop the blood pressure when they stand up. And if that's the case, sometimes we set the goal of blood pressure higher at about 140. But most diabetics, the blood pressure should be below 120 over 80. If you have a high cholesterol, set your LDL, which is the bad cholesterol, LDL goal below 100. If you don't have any plaque buildup, and below 70 if you have plaque buildup, and even possibly below 50 if you already have plaque buildup. So again, talk to your doctor what should be the target for LDL for the bad cholesterol. Again, blood pressure and LDL are very important as lowering the sugar, because as I will teach you in the complications, that diabetics don't die from high sugar. All diabetics die from heart attack or stroke or kidney failure or many other complications. They don't die from sugar. To prevent the complications in terms of heart attack and strokes, controlling blood pressure, controlling the bad cholesterol, LDL, is very important. So make sure you talk to your doctor about blood pressure and LDL, not just the sugar and A1C. What are the labs each diabetic patient should get? Every diabetic patient obviously should have fasting blood sugar done. They should have A1C done. They should have HSCRP done, which is a marker of inflammation. They should have checked the creatinine, which is the function of the kidney. So again, you all should know how your kidneys are if you have diabetes, particularly if you have type 2 diabetes. Also check ALT and AST, which are liver enzymes, because many diabetic, particularly obese diabetic patients, they have fatty liver and they're at risk of developing cirrhosis. So make sure you know your liver enzymes. You should also know a urine microalbumin, which is a protein in the urine. So if you have diabetes, typically you excrete or you spill protein in the urine. And if that's the case, you have a higher chance of kidney issues, kidney problems, kidney failure. So you should know how much protein you have in the urine. You should all know about your cholesterol. You should also check Cpeptide level, which we'll cover in a second. And many of you may need an insulin level also. Obviously, stay in touch with your doctor to see what labs you need. I want to cover C-peptide level a little bit more detail. C-peptide test many times is not done by many doctors, but you should know why C-peptide is important. C-peptide reflects actually insulin production and efficiency and function of the beta islet cells where the insulin is made. So whenever you secrete the insulin, whenever you secrete the proinsulin from the beta islet cells, it breaks down into insulin and C-peptide. So if you measure the C-peptide, it reflects how much insulin you are able to secrete from your beta islet cells. Check for all lean diabetic. If you have a diabetes happening around age 35, 40, and suddenly you need insulin, then you should check your C-peptide level to make sure you don't have a adult onset type 1 type diabetes, like type 1.5 diabetes. Make sure you talk to your doctor that if you are needing suddenly insulin, do I need to have a C-peptide level check? Obviously, I'm not the expert on diabetes. I'm a cardiologist. But if you have any questions, talk to your primary care physician, talk to your diabetes doctor. But again, you may need to check C-peptide level. How about checking things at home? Definitely, you should be checking your fasting blood sugar as often as you can, particularly if you're on insulin. But even if you are not on insulin, checking fasting blood sugar is very important. Definitely check your post-meal or post-prandial blood sugar to see how high they are spiking with what kind of food. Again, this concludes the current segment. I'm going to ask you just a few questions. Just reflect as you are listening. Just think it through. So do you believe that you can reverse type 2 diabetes and can get off all the medications? Just think it through yourself that you believe that you can reverse type 2 diabetes. Many doctors don't, many patients don't, but let me tell you, you can reverse type 2 diabetes and can get off all medications, including insulin. And I'll show you how you can do that. And if you have diabetes type 2 or type 1, do you know your last A1C? Every diabetic patient should know their A1C. Every diabetic patient should know their A1C. So if you don't know your A1C, talk to your doctor and know the A1C. And has your doctor set the target for your A1C? You should also know what A1C you are aiming for, whether it's a 7 or 7.5. Again, in my opinion, if you can get off insulin, if you can get off many diabetic medications, you can set your goal lower than 7. But again, stay in touch with your doctor about that. Again, this brings us to our health coaching program. I've been explaining you that we have started this health coaching program. It will be in function from July 1st. We already have a person who's a great person. She was a personal trainer. I've been training her, teaching her how to help people with nutrition, with exercise, with sleep, with all the 6 pillars of healthy lifestyle. If you are interested, either text me or text Hannah. Or just put interest in our Facebook page, and you'll be able to stay in touch with us. Again, this is end of segment 5. We will go to segment 6 tonight also. Segment 6 will cover diabetes, medications, and diet. If you are on Facebook Live, share with your page so other family and friends can be on the live. Otherwise, invite your friends and family to like our page. We are also on Instagram. We are also on YouTube. Our YouTube channel already has about 30 or 40 videos. So please subscribe to our YouTube channel. Watch all the videos. There are videos on healthy eating, exercise, sleep, fiber, happiness, many different videos on our YouTube channel. So please watch those videos, ask questions, have comments, and I can assure you I read all the comments and I answer all the questions. So again, this brings us to our segment number 6. And that will start with diabetic medications. This is again a busy slide. You don't have to read it. I don't think you can read it on your phone. If you're on your computer, possibly you can read it. And this is a busy slide of all the medications. Obviously, I'm not expert on diabetic medications because I don't prescribe diabetic medications. So I'll briefly cover this thing. The most common medication for type 2 diabetes is metformin. I'm sure many of you have heard about it. Many of you are possibly on metformin. So remember, metformin is one of the most common medication. There are other medications like sulfonylureas, which is one of the older medications. I typically don't like sulfonylureas anymore. It has many complications, including low blood sugar, many heart complications. So if you're on sulfonylurea type medications, which are typically amyral, glipizide, micronase, glyburide, talk to doctors to see if you can get on some of the newer medications. One of the newer medication class is called incretin mimetics, which is a few of them are Byetta, Victoza, Trulicity. Those medications work through stimulating a hormone in the gut, and that makes pancreas secrete insulin. And that also is one of the newer medication, one of the safer medication, one of the better medication. There are other medications. One of them is a DPP4 inhibitor, which also works through the gut hormone, GLP-1. It prevents the breakdown of GLP-1. And there are many medications like Januvia, Ongliza. Those medications are also good medications. Talk to your doctor. There is a new class of medications available which excretes the sugar in the urine, like Invorkana or Farxiga. Those medications are also good medications. So again, talk to your doctor what kind of medication you should be on. Some of the newer medications have shown some promise in preventing heart complications, including heart failure, including many cardiovascular complications. So make sure you talk to your doctor what type of newer medications you can be on to prevent the complications of diabetes. If you're on diabetic medications, particularly if you're on metformin, make sure you are on B12 supplements. All metformin patients should be on B12 supplements. All metformin patients should be on B12 supplements. So if you are not taking B12 and metformin, start taking it as soon as you can. You can get B12 supplements typically under the tongue supplement, sublingual or under the tongue supplement on Amazon for like $20 a month. If you are vegan, definitely consider taking B12 supplements because vegans are typically deficient in B12 supplements. Again, ask your doctor if you can be on some of the newer diabetic medications. As you start following my program, your need for diabetic medications will go down. You probably will save tons of money on that. Your sugar may start going down. So make sure you stay in touch with your doctors. Again, once you're on insulin, it's very hard to lose weight. Insulin actually retains water. Insulin also promotes weight gain. So again, goal is to get off the insulin as soon as you can. These are some of the side effects of insulin. Again, insulin, in my opinion, unless absolutely necessary, should be weaned off or should be stopped as soon as you can, safely can. Insulin is just not good drug to be on. Insulin can cause hypoglycemia, low blood sugar. Insulin can cause higher chance of heart disease. Insulin can cause weight gain. Insulin can cause many renal kidney issues. Insulin can make you more prone to clots. So again, insulin definitely is not the medication I would like you to be on. If you're type 1 diabetic, you definitely need insulin. But even in type 1 diabetic, if you follow my program, if you lose weight, if you exercise, if you get your body mass index below 25, below 22, even in type 1 diabetic, your need of insulin can go down and you may be only on 40 or 50 units of insulin per day instead of 100 units per day. If you're type 2 diabetic, if you follow my program, you definitely can get off the insulin and can get off many medications. So let's talk the major topic tonight, that's diabetes and diet. If you have type 2 diabetes, even if you are type 1.5 or type 1 diabetes, diet is the most important part of taking care of diabetes. Again, diet is the most important part. Diet actually is as important, if not more important, than even taking medication. So let's cover the diet and diabetes. Again, type 2 diabetes is a disease of what we eat. type 2 diabetes happens because what we eat. So therefore, the treatment will be also what we eat. Again, it's very simple. Diabetes, type 2 diabetes happens because what we eat. So type 2 diabetes will be treated also with what we eat. This is a very important statement by Hippocrates. When the diet is bad, medicine is of no use. When the diet is right, medicine is of no need. Such a powerful statement that if you don't eat what I'm going to show you, medicine may not work and your diabetes will keep progressing. But when you eat what I show you, what is healthy way of eating, you may not even need the medicine. So remember, when the diet is bad, medicine is of no use, they don't work. When the diet is right, medicine is of no need. Uh, that brings the why many doctors, I would say most doctors don't talk about lifestyle and diet. Many times, many patients come back and tell me that their doctors are not talking about the lifestyle and diet. Partly, there are many reasons, partly because doctors get only about 5 hours of nutrition education in the medical school. When I was in medical school, I got less than 5 hours of education on nutrition. Most of my nutrition was just few hours in biochemistry about carbohydrate, protein, and fat. We did not talk about how to cook. We did not talk about what food has what macro ingredients, how to avoid certain food ingredients. We did not get any of that education. And most doctors think that teaching nutrition is a job of a dietitian or a nutritionist. In my opinion, that's wrong. Every doctor should talk about nutrition. Many doctors don't get paid to talk about lifestyle and nutrition because there are no codes in insurance paying system to get paid for lifestyle education. Lifestyle education takes long time. I can do a procedure to put a stent or put a pacemaker. Takes me half an hour, 1 hour to do it. I can get paid $1,000. But if I talk 1 hour of lifestyle, either I don't get paid or I may get paid $50. So many doctors, obviously not all doctors, but many doctors will do the procedure, which is high paying procedures. Many doctors don't have time. Doctors are under pressure. There are not enough doctors in this country. Many doctors get 15 minutes per patient to see. And in that 15 minutes, they have to cover many, many issues. If a person goes with a bad joint, like a joint pain, person goes with a sore throat, and if that person has diabetes, obviously doctor is going to talk about what the active problem is and may not talk about lifestyle, may not talk about nutrition. Again, doctors don't have enough time. Many doctors don't do it themselves. Obviously, as a doctor, we don't set good examples. Many doctors don't eat healthy. Many doctors don't exercise. Many doctors don't sleep well. Again, so doctors themselves don't do it. So they are not setting a good example for their patients. Also, many doctors are brainwashed and influenced by big pharma industries. Again, many pharmaceutical industries, many drug companies have brainwashed the doctors that diabetes means taking medications. That obviously is wrong, but they're all influenced. And again, that happens to any doctor, including myself. We all are human and we get influenced by big industries. And most doctors believe in pills and procedures. When we go through medical school, when we go through residency, when we go through fellowship, most of our education is about how to prescribe pills, how to take care of patients with medications, and how to do procedures. Doctors are not trained, doctors are not taught how to change lifestyle and how to teach nutrition. Again, these are some of my thoughts. Not all doctors are like that. Hopefully, your doctor believes in nutrition, your doctor believes in lifestyle, but it's a good idea to ask your doctor, how can you improve your lifestyle and how can you improve your nutrition? So again, this calorie in, calorie out model is a kind of an old model, and many times it doesn't work. When you put, for example, any kind of food in a closed system, you may get exactly the same calorie out of it or same energy out of it, but in the body it doesn't work that way because body has many hormones and influence, even influence of microbiome, which also consumes energy. And there are many more influences. That's the reason this calorie in, calorie out model doesn't work. To give you an example, eating 100 calories from a cookie versus 100 calories from broccoli is not same on the health, not same on diabetes. So again, many people say that if I control my calories, I will be fine. It doesn't work that way. 100 calories of cookie is not same as 100 calories of broccoli. Remember that. It's not the calorie, it's the type of food you eat. So again, let's start with diabetes and diet. My recommendation is whole food plant-based diet. Whole food plant-based diet. That means eating fresh vegetables, cooked vegetables, fruits, uh, and whole grain. Whole grain. And we'll go through what it means. I also recommend no oil or minimum oil. We don't need oil in our diet. So if you can do no oil, that would be perfect. I also recommend low animal products or almost no animal products. So that means 10% of your calories should come from animal products. That means any kind of meat, whether it's a red meat, white meat, fish, or any dairy, should be less than 10% of your calories. I also don't recommend uh, uh, a low carb, high fat diet, which is a keto diet. I'll show you as we go why I don't recommend that. Obviously, the data is still coming out and jury is still not decided, but I personally don't recommend keto diet right now. I recommend low fat, high carb, low fat, high complex carb, or high whole food plant-based carb with a carb about 70%. And I'll show you why I recommend that. My approach is an evidence-based approach. My approach is a science-based approach. So I'll show you. My approach is also very practical approach. My approach is also very sustainable long-term approach. Again, when you look at the diabetic diet, the major issue is the caloric excess. We are eating about 500 calories more compared to 40 years ago. Every American is eating 500 more calories every day. And we are exercising same. So we are essentially having caloric excess of 500 calories per day. So number one goal for diabetic diet is to lower your caloric intake. We all need to cut about 500 calories. Obviously, if you're an athlete, if you're very active, you may have to eat more calories. But again, you all should know what is your basal metabolic rate, BMR, and then add the expenditure based on your activity level, and you should know your daily expenditure and eat the calorie accordingly. If you need to lower your body mass index, your BMI below 25, start eating or start having 500 calorie deficit. That will give you 1 pound of weight loss per week. If you create 1,000 calorie deficit, which is very hard to do, you will lose about 2 pounds a week. My recommendation is losing about 1 pound per week if your body mass index is about 25. I highly recommend that if you have type 2 diabetes, bring your body mass index below 25. You probably will get off the insulin, you probably will reverse diabetes, and you will get off many medications. If you are certain ethnic background, for example, Asians or Indian Americans or Indian, then I would actually ask you to bring your body mass index below 22. You all should know what your body mass index is. You can easily calculate body mass index by going on an online calculator. You just need your height and weight to calculate the body mass index. So again, if your body mass index is about 25, start creating deficit of calorie, eat less calorie to bring your weight down, to bring your body mass index below 25. If you are Asian, if you are Indian, if you are Indian American, then bring your body mass index below 22. Again, it continues the whole food plant-based diet. That means, again, eating fresh vegetables, cooked vegetables without oil, whole grain, and we will see, well, I'll show you what whole grain means, and no oil. No added sugar. Any sugar in the natural food is fine, but no added sugar. Fruits are fine. Fruits are not enemy in diabetes. Many doctors, many people think fruits, because of the fructose content, because the sugar content should be avoided. But in my opinion, fruits are allowed in any diabetes, as long as it's a fresh fruit or frozen fruit without any added sugar. Only eat whole intact grain, and I'll show you what those are. In my opinion, we should have a complex carb 70 to 80%, fat 10 to 15%, and protein about 10 to 15%. Again, I've shown you in segment 3 and 4 why insulin resistance happens is because of high fat diet. That's the reason I like to keep the fat calories no more than 15% in your diet. preferably less than 10% of your calories if you have diabetes. Complex carb from whole food, plant-based should be about 70 to 80%. And I'll show you how this diet has been followed for centuries, for thousands of years, when people were not obese and people did not have diabetes. This diet has been tested for hundreds of years, if not thousands of years. Definitely fat less than 50%, ideally less than 10%. Saturated fat should be less than 10 grams per day. And you can read the label to make sure you're not getting too much saturated fat. Uh, Again, protein should be maximum 70 grams per day. Even in female, it should be about 55 to 60 grams. If you are obviously athlete, if you have a big bony structure, you may need 80 to 90 grams, but definitely nobody needs more than 80, 90 grams of protein. And that protein should be ideally plant-based protein, which we will also cover why it should be plant-based. Again, most Americans get more protein than they need. Most Americans get more protein than they need. Whenever I have a personal trainer, first thing he asks me, how do I get my protein, whether I'm getting enough protein or not. My personal trainer advised to have a protein powders, protein shakes, protein bars, and he says you need to increase your protein. Nobody needs to increase the protein. As American, we get enough protein. If not, we get more than twice the protein we need. And protein actually now has shown to cause less lifespan. People who eat more protein than recommended live less. So again, definitely don't have too much protein. Don't get brainwashed by any personal trainer. They need more protein. I definitely am not advising keto diet. Again, a lot of doctors advise keto diet. Be your own judge. Read books, read research articles, watch YouTube videos, be your own judge. I personally myself don't recommend keto diet for anybody, for any disease or for diabetes. Definitely no processed food. Processed food is one of the reasons type 2 diabetes is on the rise. Americans eat 65% of the calorie from processed food. Again, Americans eat 65% of their calories from processed food. Processed food needs to go down. I actually highly recommend that you keep track in a notebook or on your phone every day what processed food you had. So if you had chips, or if you had any kind of bars, any kind of processed food, essentially, make sure you write it down so you start to know what processed food you are eating. If you eat whole food, plant-based food, and avoid the processed food, and avoid the oil, and avoid or minimum the animal products, I can assure you, you will start reversing your insulin resistance. Definitely have enough water. Most of us don't drink adequate water. Many times when we are thirsty, we think we are hungry and we reach out for food instead of reaching out for the water. So I have minimum 64 ounces of water. Again, if you have obviously kidney issue or heart failure, talk to your doctor how much water you should be drinking. But most people should be drinking minimum 64 ounces of water. In terms of nuts, nuts in general are healthy food. But if your body mass index is about 25 or about 22, avoid nuts until your weight comes down. Again, if your body mass index is 35, and if you are clearly obese, you don't need the health benefits of nuts. You can get enough omega-3, which we will also cover, from just 1 tablespoon of flaxseed. 1 tablespoon of flaxseed. You don't need calorie dense. You don't need high calorie nuts if you are obese or if you are overweight. And definitely, I recommend no oil or minimum oil. Again, you should be eating most of your meals at home, home cooked meals. Eating at restaurants obviously brings a lot of large portion size, lot of calories, lot of saturated fat, lot of oil. So eat as much as you can at home cooked meals. Avoid any animal products as much as possible. Like I said, any kind of meat, red meat, white meat, fish, or dairy should be less than 10% of your calories. Avoid the dairy as much as possible. I know a diabetic doctor who highly recommends no dairy if you have diabetes. I definitely also advise no oil, no margarine, no Crisco, or no trans fat. We'll cover trans fat as we go. I also highly recommend to take your lunch from home if you are working, because homemade food is always healthier. You know what went into that food, and it'll be always better for you. So again, take your lunch from home. I take my lunch from home. It doesn't take more than half an hour to prepare it. Have it lunch prepared the evening before. Have it ready in your refrigerator. So when you wake up in the morning, you are out with the lunch bag in your hand. You don't want to prepare lunch at 6:30 in the morning. My lunch is prepared the evening before. In the morning, I have lunch ready, and I just leave with my lunch when I leave for work. Again, When you start eating like this, when you start eating whole food, plant-based, no oil, minimum animal products, no processed food, your sugar will start coming down before even your weight comes down, because you'll be clearing out fat from your cells. I will explain you the mechanism of insulin resistance, which is essentially fatty acids in the cell. As you start eating low fat diet, as you start eating low fat diet, as you start eating less processed food, less sugary food, less cakes, less cookies, your sugar will start coming down very rapidly, even before you lose any significant amount of weight. Uh, so again, I repeat myself, if you eat healthy, if you eat whole food, plant-based food, that means no processed food, minimum animal products, and no oil, your sugar will start coming down before even you lose weight. And this concludes this segment. I'm going to ask you a few simple questions. Do you start to feel, based on so far segments you watched, segment 1 to 6, that it's the fat or it's the simple carb, not the carbohydrate itself, which leads to obesity and type 2 diabetes? Again, what I'm asking you is that, do you think carb is the enemy, or it's the simple carb like white flour, white rice, white bread, and the fat is the enemy? In my opinion, carb is not the enemy. It's a type of the carb, and it's the fat in the diet which is the enemy. And I'll show you, I'll prove it to you as we go over through next few segments. Do you also agree that saturated fat in our diet has led to obesity and type 2 diabetes? Again, if you have seen segment 1 to 4 and now segment 5 and 6, you can start to realize that it's the saturated fat in our diet which causes type 2 diabetes. And again, I ask you, what kind of diet do you follow? If you have type 2 diabetes, do you follow whole food, plant-based diet with no oil, with minimal products, minimal or no processed food? This is very important because, again, like I said, type 2 diabetes is caused by what we eat. So type 2 diabetes will be treated and reversed by what we eat. Treatment of diabetes mostly depends upon what we eat. What we eat is the most important part. I keep repeating myself, but it's very important. That brings us to, again, our health coaching program. We have started this health coaching program. It will start July 1st. If you are interested, please reach out to us. Again, this concludes our segment number 6. We will go to segment 7 and 8 tomorrow. Segment 7 will continue with the further talking about diabetes. I'll show you how blue zone people ate, how we can reverse the diabetes. If you are on Facebook, please invite your friends and family to like our page. We are growing very rapidly. We have about 11,000 followers now in last 4.5, 5 months. We are also on Instagram. We are also on YouTube. Subscribe to our YouTube channel. We have about 30 or 40 videos on YouTube channel. Watch all those videos. Have your comments, have your questions. I always read every comment. I always answer every question. I hope you are enjoying this lives. I've been doing it pretty much 4 or 5 times a week. I hope you are learning. I hope you are getting healthier. I've taken up this mission over the last 3 years, particularly over the last 5 months, not just to be healthy myself, but to also make all my family, all my friends, all my followers as healthy as possible. Getting healthy is not that hard if you make certain discipline. More you know, better for you. So learn from me, watch more YouTube videos, read more books. I always have recommendations of what books you should read. I always have recommendations of what videos you should watch. When this diabetes seminar ends, last segment, I have list of all the authors you should follow, all the YouTube videos you should watch, all the books you should buy. So stay tuned for the last segment of this talk. But again, more you know, better for you. Again, this concludes our slides. I have covered now segment 1 to 6. Segment 1 to 4 are already on YouTube. If you have not watched them, please watch segment 1 to 4 when you have time. This segment 5 and 6, which I did tonight, will be on YouTube, hopefully tonight, by tomorrow morning for sure. Thanks to Hannah, our social media person. We've been very organized. We post 4 or 5 times a day. I take a lot of efforts in finding right material to post. Our posts are not just about healthy lifestyle, but our posts are about how to stay motivated, how to have a good relationship, how to have material success, how to be successful in our career, how to be a good spouse, good husband, good wife, how to be a good father, how to be a good son, a good daughter, a good mother, how to be a good friend. So again, my approach is a whole person approach, not just a health approach. It should be a physical health, mental health, spiritual health, social health. And I take special pride in myself trying to do that. And I take special pride in teaching you the same thing. So I hope you're liking what we are doing so far. I'm going to end tonight. Ask your questions. We had a great turnout today. We are almost 25 people watching it. So thanks to all the people who watch live. This will be on YouTube by tomorrow for sure, possibly by tonight. So stay tuned. Thank you.